So, Dr. Akeem Marsh, I am currently the assistant medical director at based out of the New York Foundling's mental health clinic, which is physically located in Harlem. I let's see, so many different ways I can go. I so I'm a child and adolescent and adult psychiatrist by training, and that's basically like a medical doctor, MD, who specializes in mental health treatment. And I have a subspecialty focus for children and adolescents. And my background prior to the clinic is in different settings, hospital based and emergency room, doing psychiatric services there, as well as working in juvenile detention. And I also have a faculty appointment with New York University School of Medicine, where hopefully, if everything goes well, I'll be teaching an undergraduate course. And based other little info about me. So even though, like I was mentioning before, I'm from the Bronx, like I have connections to a lot of the places that were named. So Harlem, well, I'm currently working there, was one of the places, but also like when I was young, middle school, teenage years, I spent a lot of time actually right in that area because my best friend lived over there at the time. So I spent I can't say I grew up there, but I kind of did, in a way. So I know what it was like. And then Brooklyn, shout out to Brooklyn. I went to SUNY Downstate. Well, now it's called Health Sciences University, but medical. That's where I got my medical degree. So that's that. Um, and besides the clinic job, I also have a. I also work for this media company called Very Well Mind, which produces a lot of health related content that like when you search up different things on the internet, they're like one of the first things that pops up. For them, I'm like on their medical review board. They send me articles about mental health related topics, and I just give feedback and approve, or yeah, basically that's what I do for them. And last but certainly not least, I also recently published a book that I co-edited called Not Just Bad Kids: The Link Between Adversity and Disruptive Behavior. And that book is actually for the intended audience is like anyone who's interested and who's going to be working with youth. Is basically, to summarize, it sort of adds perspective to people you see who might have what they call disruptive behaviors, acting out, aggression, and different things along that spectrum, really linking it to prior experiences of trauma or some type of abuse that they might have experienced in their lives, and just kind of really trying to add perspective to get people to understand and really wonder what where someone's coming from before making a judgment. Yeah. Um, so we can move on to the questions.
Well, thank you, Dr. Marsh, for sharing your amazing bio with us. For the first question, we would like to know, how would you define mental health in your own words?
Ooh, good question. I think when I think of mental health, I think of like having sound mind, sound body, and sorry, a little distracted. Sound body and sound mind, really uh taking care of yourself, making sure that you know I'm doing what I can to to really make sure I'm level, to really ground myself. And that includes both being proactive with things like making sure the basics, like making sure you get enough sleep, making sure you get enough to eat. And it also includes other things that are a little more proactive, like meditation and going to therapy, things like that. And the way I describe it is like with some is how you know how the character Batman has a utility belt and there's all these gadgets and things on there. I kind of think of like the utility belt as um, all of the things that we need for proper mental wellness, and that would include those different things that I was naming, like proper sleep, proper eating, proper making sure you get therapy, rest and relaxation when you need it. You know, some days like we have this drive to really push ourselves just because of how society is set up. But you know, like some days, like, you know, if you don't take the rest, you know, when you need it as to the extent you can, then, you know, your body's just kind of force it and, you know, shut down. So we want to try to avoid getting to that point if you can.
Thank you. I haven't seen the new Batman movie, but I'm planning on seeing it this week. So yeah, that's a great correlation.
Awesome. I didn't come up with that. I wish I did, but I love it. So I like to share.
Yeah. So our next question would be, how can we as students make an impact on mental health from your perspective?
Oh, yeah, absolutely. So for that, I would say uh, make sure that you take care of your own mental health first. Like that's important. Life is stressful. School is stressful. You know, everything, so much stress all around us. Um, so it's very easy to get lost and consumed by that. And then as we're taking care of ourselves, you know, also be mindful of the people you know, the people around you, your friends, your network. If you see or happen to notice that something's a little off, something's different about them, then, you know, maybe think about mental health and also think about that this person may need some extra support, you know, which could be anything from giving them space to uh, you know, just being there to listen, or if they're really struggling, maybe encouraging them to get help, because sometimes people like us as individuals are not always able to see that something's going on. It may take someone else to point it out for us, and then, you know, okay, then we can address it.
Okay. Well, I have a follow-up question for that. So you said for certain situations you feel like we should listen or we should go and tell the person that they should need ask for help. When do you feel like in those type of situations, when do you feel like which one should we pick? Like should we be a listener or should we tell them to go seek guidance from somewhere else?
Oh, that's a great question. I think it comes down to you know, as a friend, you can always at least start with, you know, asking them like, okay, I'm your friend. What can I do for you? You know, if you need me to just listen, if you want advice, you know, you let me know. And then I would say if if the person starts talking and is going somewhere that, you know, you really feel you're not equipped to handle, like, okay, this is too much, or if it feels overwhelming or burdensome, then in a situation like that, you know, I would say like, okay, all right, I'm grateful, you know, that you feel safe and comfortable to share this with me, but it sounds like, you might need some extra help, because to be honest, like, I want to help you, but I'm not really equipped to do that, because this is out of my lane. At a certain point it may be. And then in that case it would be like, okay, maybe why don't we try to find someone for you to speak to? Why don't we, or like, if you can help them directly, like, because I don't expect students to know how to do that, but you might be able to. But at least you can ask someone who should know, like a guidance counselor, or maybe, like, there's a few different ways you could go about it. Guidance counselor is one. Letting the parents know if you feel safe enough to speak to them, like, about it, or the besides the parents, it's some other adult who's like trusted, who may be able to help.
Thank you. One more question. We've seen you spoken a lot about racial equity issues. What do you think about mental health support provided to the people of color?
Oh, we got to do so much better. So much better. No, you know what it is? It's like this. In general, the mental health system is like very, very fragmented, and is is not is not designed in a way that would would be conducive for all people, for everyone. Is very fragmented and fractured. So I think ideally, like, everyone should have access to an annual mental health check-in, right? At least that when we have our physical every year, at least a mental health, like a physical, like the same kind of thing. And then if you happen to need more, then you could get more. And if you don't need as much, right, then you just continue with the annual. Although, like, at the same time, I'm saying that is like, I also think that there's benefits for most people, if not all, to have some sort of therapy in their lives. But then also to factor into that as well, for the therapy itself, is like the excuse me, the majority of uh, clinicians, psychiatrists, psychologists, and mental health. So there's different levels. There's social workers, mental health clinicians, psychologists, psychiatrists. The majority are white identified, and then some is more drastic than others. Like in psychiatry, it's very drastic. It's like 2% of the psychiatrists are Black, and it's less than that for Latinx, like maybe closely behind that. But it's just like, and that's 2% of in the whole country, and we're talking about being there for large segments of the population. Like, I don't know the exact numbers, but it's at least like 80 million, something like to that effect. So it's like this a huge disparity. And then but that's not even the biggest thing, that's the barrier. Like, most people kind of assume that that's the biggest hurdle. The biggest hurdle is actually insurance and access, like, and then, but those things are also like along racial and ethnic lines. Like, we're less likely to have good insurance, although none of these insurances are really good. Like, they they gotta go too. We gotta fix all of that. So there's like so many different layers to it. And but as I'm saying all of that, I gotta drive home the point, though, that even though all of that is true, at the same time, I want to say, like, it is possible. Like, services are available, especially in a place like New York, you know, which is relatively resource rich. And then even now with telehealth, which is like, doing your services on the web, on by video call, that expanded the options, that expanded the horizons. So um so there's the possibility exists that people can get services. And I was talking about the disparities between like the different racial and ethnic backgrounds of providers, but uh I think that when there's more diversity, it will help all of us do better. It's just that that oh wait, sorry, was my train of thought. When there's more diversity, it'll be better for everyone. But at the moment, like, it's not to say like I don't want anyone to be discouraged from seeking help. It's just we got our work to do, just like in other settings as well.
Thank you. I really like how you said that everyone should have access to an annual mental health check-in along with the physical health check-in, because just as like the physical is important, the mental health is just as important. And the mental health is the foundation. So if that's not checked in, it's like how is everything else is gonna fall into place. So I like how you said that. So thank you.
Yeah,
Um,
on that note, I was just gonna say, like, I feel like it's more because I've seen people, debilitated, and I've seen, and if you're like debilitated, then you really can't do organize yourself to do basic things. And then even there's so many things going on, so many barriers, like internal barriers for people. That doesn't make it like you have a major mental illness, but it's like your mental health is not optimal. It's not like functioning at a place where it could and should be. So, like there's more of a reason to really encourage um people taking care of their mental health.
I agree. Thank you. Moving on to the next question. We've seen that you've spoken on the pandemic in your previous work. How do you think the pandemic has affected mental health, particularly with regard to online education or other restrictions? And how do we balance safety and other forms of well being?
To be honest, the I feel like the pandemic has kind of been like a disaster for mental health. As far, it's like if you weren't feeling a little bit of something before, then you're at least going to experience something. And it actually got to the point where some professional organizations, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association, those three organizations basically joined together and declared a national state of emergency for children's mental health. And that was just based on you know, all the things like, people's families being disrupted, financial issues, losing relatives, and then like the isolation, so much isolation in the different areas, like having to spend more time away from just regular things like regular social activities and stuff like that that otherwise we would use as a means of self-care, just basic things. And like I think to um to balance safety and like mental well-being, we like well, ideally people would have handled the messaging better than it has been, because I feel like when I say messaging, I mean like just the way the national discourse has been talking about everything, really like like explaining things to people and being honest totally, right? So like people have set it up in a way to give us this idea like, okay, like there's this thing going on, but one day, boop, it's just going to be over. And then right now, it's like so many of the restrictions were lifted. So in a way, it's like on the surface, boop, things are over, but it's not really over. So I think at least going forward, the best way to safely manage would be like some combination of doing things virtually when it makes sense. And then, we still need some in-person interactions. So like that's also going to be part of it. But like just taking more advantage of virtual when we can. And then, but still like for learning in school, it was not overall, I don't think it was useful. Like, I mean, we had to do what we had to do, especially in the very beginning. But learning like trying to learn remotely, I know that was a huge challenge because that was like the reason for so many of the referrals we got were all related to school. People not logging in and stuff like that. And that's like not just a simple like a lot of times people would think it's just a simple like oppositional thing, but it's not. It's like attention. It could be stress at home, no Wi-Fi, or so many different reasons. And like people, we should figure out better ways to be able to help in the ways that we can.
Thank you. And as a follow-up question to Kiara's, what is your best coping mechanism idea for people of color when dealing with COVID-19 or other forms of depression or anxiety?
Oh, okay. I love that. Ideally, I would want if I could do this, if I could make this a reality, ideally I would want to write a prescription for everyone to have a loving family, supportive network. But unfortunately, like that's not something that could be put on a prescription. And I'm bringing that up because what I think what is most impactful for people is like the meaningful relationships that they have with other people. Ideally, that would be a loving and supportive family. But like hopefully everyone at least has like one person, somebody in their life, and then like I'd want those people to support each other. And that would be like the most helpful as a basic. And then beyond that, everything else in the utility belt.
Thank you so much for that. That's a really good point you made. And I know we're going a bit over time, but our concluding question, if you don't mind answering it, is what do you find most meaningful about your job, and what are your advice for us as students?
Oh, that's a good question. I'd say what I like most meaningful about my job is that even though it's it's uh it's kind of like a humble location, small mental health clinic. The reach is actually far. It's pretty far because the they the the clinic, the way it was set up is that there's like so many different community based like family therapy programs throughout the 5 boroughs in the city. And and um so they basically are able to you know work with lots of families across the area. And so I'm able to support that in my role because, like, part of what I do allows it to function that way. And then beyond that, like, I also like manage the psychiatry service. So like a good chunk of those clients in the different services are being seen by my service. So it's like, it's like we're not quote unquote saving the world, not like any one person or one group could do that, but like, it really feels like we're having an impact, doing our part anyway to at least try. And then on top of that, it's like while I'm doing that at the same time, I'm also like being creative as far as like how can I how can I make the services overall better. So I'm having these conversations with the different clinicians, the different therapists, talking about all the different issues related to bias and stuff like that, and encouraging them to look at themselves and things like that. And as far as advice for students, um, like when I was around 17 and 18, I guess, we kind of had to think what would the what would you like want to study? What would you want to do? So in a way, I had an idea about that. Like I was like, okay, I'm interested in pre-med because I want to challenge myself and maybe I could be a doctor someday. But whatever ideas I had about what that would look like doesn't match what I'm actually doing right now. And that's not to say it in a bad way, it's to say it in a good way. So it's like just want to show like you might have some idea or perception of you know what the future might hold, but I would say don't stay tied to any one idea. Be open, and be curious about yourself and your own interests, because like the type of things that I'm talking about, even like just talking about like bias and mental health care, is like I was not thinking about anything like that at 17 or 18. And even when more recently, like when I was going through the training programs, nobody was really talking about that. Like they talked about some some portion of it, but it was more of like not in those terms. And but even with that, this is what I'm doing now. So it's like, um, like I just want to make a point of there's lots of possibilities out there of what success might look like, and I'll feel like some things, you think like, oh, might be better for you. Like for example, like well, I didn't actually apply to any schools like this, like Yale or Harvard, but like some people might apply to a school like that and be like, oh no, I didn't get accepted. Like honestly, you're probably better off going to state school route like I did, unless you got a scholarship. Of course, take that scholarship. But yeah, I mean, it's like this is so many different possibilities, and like being open and connecting with different people in different groups led me down one pathway, led me down another one, and then now, like, there's this cool stuff happening, and I'm just rolling with it, as opposed to just kind of being fixed on like one outcome, or there were different times when I had my sights set on certain things, and some of them worked out, some of them didn't. But like I would say, like, try not to hold on too much to the things that don't work out, because some other opportunity that is just as good or better for you might be there.
Yeah, I Totally agree. Thank you so much. And
Like,
just one thing, because I
mhm.
think Sage and Ian didn't get to ask
Oh
or
yeah,
comment, so
I'm not in a rush to leave, so
I appreciate that.
Hi, Akeem. So my question was, can you tell us more about your recent book, Not Just Bad Kids?
oh yeah. So basically, the idea for that came from my experiences working in juvenile detention. You know, I I started working there before I worked there. Though, I didn't really. I had background in mental health in like other systems, like in hospital, clinic, and so I'm in there. Like, what is juvenile detention? Kids are there, like almost being given adult treatment, like arrested, charges pressed, criminal charges, and I'm just like, what happened? Like, what's going on? Like, this can't just be it. Like, there must be more to the story. It was like that. And then started leaning into thinking more, doing more research, getting a better understanding of, or trying to get a better understanding of what might be going on with this individual. And over time, noticed that there were certain things that were like patterns, certain things that kids had in common. And then, like, as more time passed, and I'm also working with other people, there's like all these like aha moments. So like basically, a lot of the kids, if not all of them, have been through some trauma, some type of psychological trauma, and like trauma itself is something that's very common. So everyone to a degree has experienced that, but the difference between people who end up in settings like that versus the general population is that those kids happen to experience a lot more than most, and it wasn't just a lot more, it's like layered on layers of it. The types of things, like, if you heard it, it's almost like you wouldn't believe stuff like that happens in the world, or you would hope it doesn't, but it actually does. And what I'm talking about is stuff like, okay, like, quote unquote simple trauma would be like, I was in a car accident, or maybe I got mugged, or maybe um you know something happened in my family where we ended up in foster care for a while. It's like they got all of that plus all these other things. And like, when you have exposure to situations like that, circumstances like that, then the types of reactions that you would see are different than what we would expect as quote unquote normal reactions. Like, uh for example, like, I'm thinking, let's say you saw somebody who seemed like they were upset, like, and then you just kind of, sometimes people will like maybe put their hand on their shoulder or something to try to show that you're supporting. This person might start swinging at you. They might, curse you out. They might explode. And you're like, whoa, I was just trying to help. Like, you know, but the reason why why that reaction happened is because, uh, you know, they've they've been violated in some way, in so many different ways. So as a means to like protect themselves, and it's not even conscious, it's more like unconscious, like they just had to really fight to protect themselves. And so situations like that will happen, and somehow they end up in trouble, in some kind of trouble, and then they end up in the system like that. And so like the whole idea for the book was like, really um kind of like going through different stages of potential stages of someone's life. So we talk about it from early childhood. Well, actually, even yeah, you could say like early childhood, and then go through the different stages, and then like I'd say it's more focused, a little bit more focused on teens, but we also talk about like different aspects of the teenager's life, their peer relationships, if they were in foster care, what that would look like, what it would look like in juvenile detention, and what it would look like in school, stuff like that, the types of things you could expect. And then we also talk about what it might look like in adulthood, and go and also go through different things that may factor into it, like talking about racism, and then all the other isms, like there's sections on that. And at that we finish off talking about ways in which trying to empower the person, whoever's going to be working with kids, like these are ways, some of the ways in which you can really be there for that person, really. And then there's also a little bit, but not too much emphasis on this, but like some of the different types of treatments that are available, because there's actually, so there exists so many different treatment options, but we're regular people, we're limited to like what's available around us, what's available, like what we can access, because some of those things are like accessible, but only in certain areas. So
Thank you for your point. I appreciate it. I definitely do think that uh, there's always more lying underneath the surface, as you were saying.
definitely. And I mean, I think, and the nice thing about it is like we're focusing on people who are in a certain type of situation, a certain type of, but I think it's actually true of everyone, that that's like one of the things I really learned, like, okay, it's like that for everyone, just an example, like, if somebody is acting out in some kind of way or something, just maybe think maybe something's going on with that person, they got something going on, like it doesn't have to be like a major mental illness, but you know like I'm angry today because it's the anniversary of someone in my family who I was close to, who passed away. And that's not something that necessarily people would just be open about, but those kinds of things play into to everyday life.
Oh yeah, thank
Thank
you for sharing something like that. And I'm sorry for your loss.
Oh no, I'm sorry. I was just using that as an example. Like that's not actually me, but
Oh,
I meant that as an example. Like someone might be angry today because they went through that.
I thought you actually. Okay,
Oh
I'm
yeah.
sorry.
No, it's okay. No, I did say it like it was me, but I'm sorry. That's what I meant. Like someone might be angry today because that happened. And
thank
Yeah,
you
I
so much, Dr.
understand.
Marsh, for your answers. And one closing questions that we
Mhm.
have is, how could other laws or policy be changed to improve mental health and mental health education?
Oh, that's great. Well, I think for laws, I I would advocate for people having like increased access to insurance, or at least yeah, insurance. I mean, because that's how it's set up. So increase access to care. And because if with just with something like that alone, like for example, we have an example from recent history, actually, the Affordable Care Act, when that was passed. And then like years later, it's like with the Affordable Care Act, it was a combination of Medicaid being expanded, Medicare being expanded, and people having more options for getting private insurance. And just with that alone, like people were once you have that access increase, people were taking advantage of it, like using the services. Whereas before it was like people were just neglecting themselves, like not doing it. So there's one big thing. And then as far as mental health education, I feel like uh, it should be incorporated as part of our routine from, like, if we have to go to school, if there's certain things that we have to do, like self-care should be part of it. Like they should be having meditation. They should, as part of, just a few minutes, like, some self-reflection, like, and they've actually, had studies in schools where uh if you do just a simple thing, like, once a day, you'll see a lot less behavior. If you help kids to get grounded and feel safe, you'll see a lot less behavioral issues, behavioral concerns. And and that's just one example. And other things that could be done would be like um emotional, what is it, us talking about our feelings, basically, like having education on that. Like, we kind of talk about it, some, but it should be like more normalized as part of the discourse throughout, throughout all the years. And I think just those simple things could really go a long way.
Yeah, I agree. And again, well, thank you so much, Dr. Marsh, for everything. I really agree. And I think you made really good points, actually, that we could include for our website, like the insurance, how it should be affordable to everyone. And it was just really great having a person, from the Bronx who can share their perspective. Yes.
Well, I was in all these boroughs, but the Bronx is like home. So
Yeah, it hits close to home.
indeed.
But yeah, thank you so much for your time.
Oh yeah, thank you all for having me.
We'll keep you in touch with our final result for our website.
Oh,
And
that sounds good.
yeah,
Definitely.
I'll definitely keep you in touch. And thank you so much.
Thank you. Have a good night.
You too.
Thank
I
you.
want to wish everyone well. Students, guys, graduating, it's that time, stress, going to college, and yeah.
Yeah, thank you.
I miss those days, but I don't miss them.
Mm.
I remember that.
Have a good night.
Likewise. Thank you.
Good night.
You.
That was awesome.
Yeah, congratulations, guys. That went super well.
Very well done. Very good, substantial questions. I'm
Yeah.
impressed.
We
Rolling
did
with
it.
the flow, super professional. Just awesome, awesome job.
Really nice.